Osteoporosis is a condition that weakens bones, making them fragile and more likely to break. Many people don't realize they have osteoporosis until a fracture occurs, but there are early warning signs you can watch for. Recognizing these signs can help you take action early, potentially slowing the progression of the disease. In this video, we'll explore the subtle symptoms and risk factors that may indicate the onset of osteoporosis. By understanding what to look for, you can protect your bone health and seek medical advice before serious complications arise. Osteoporosis literally means porous bone. It's a disease where bone density and quality are reduced, leading to weakness of the skeleton. This condition is often called a silent disease because bone loss occurs without symptoms. However, as bones become more fragile, certain warning signs may appear. Understanding what osteoporosis is and how it affects your body is the first step in recognizing its early symptoms. Let's take a closer look at how osteoporosis develops and why it's important to catch it early. To understand osteoporosis, it helps to know a bit about bone structure. Healthy bones are dense and strong, with a honeycomb-like inner structure. As we age, or due to certain risk factors, the spaces in this honeycomb become larger, making bones weaker. This gradual loss of bone mass can go unnoticed for years. However, subtle changes in your body may signal that your bones are losing strength. Let's explore what these early changes might look like. Certain groups are more likely to develop osteoporosis. Women, especially after menopause, are at higher risk due to hormonal changes. Older adults, people with a family history of osteoporosis, and those with certain medical conditions or medications are also more vulnerable. Lifestyle factors like smoking, excessive alcohol use, and lack of physical activity can increase your risk. Knowing your risk factors can help you stay alert for early warning signs. One of the earliest warning signs of osteoporosis can be persistent or sudden back pain. This pain may be caused by small fractures in the vertebrae, which are the bones of your spine. These fractures can occur with minimal or no trauma and may feel like a dull ache or sharp pain. If you notice unexplained back pain, especially if it's chronic, it's important to consider osteoporosis as a possible cause and consult your healthcare provider. Have you noticed that you're getting shorter? A gradual loss of height over time can be an early sign of osteoporosis. This happens when the bones in your spine compress or collapse due to weakened bone structure. Even a loss of just an inch or two can be significant. If you or someone you know seems to be shrinking, it's worth investigating further, as this could indicate underlying bone loss. A stooped or hunched posture, sometimes called kyphosis or a dowager's hump, can be another early warning sign of osteoporosis. This occurs when the vertebrae in the spine weaken and collapse, causing the upper back to curve forward. If you notice your posture changing or find it difficult to stand up straight, it may be time to check your bone health. Bones that break easily, even from minor falls or bumps, are a classic sign of osteoporosis. If you experience fractures from activities that wouldn't normally cause injury, such as coughing, sneezing, or light lifting, your bones may be losing density. Pay attention to any unusual fractures and discuss them with your doctor, as they could be an early indicator of osteoporosis. Weak grip strength can be an early warning sign of osteoporosis, especially in older adults. Studies have shown that reduced grip strength is linked to lower bone mineral density. If you notice it's becoming harder to open jars, carry groceries, or perform other tasks that require hand strength, it may be time to have your bone health evaluated. Brittle or weak nails can sometimes signal underlying bone health issues, including osteoporosis. While many factors can affect nail strength, consistently brittle nails may be a subtle sign that your body isn't getting enough nutrients to support strong bones. If you notice changes in your nails along with other symptoms, consider discussing bone health with your healthcare provider. Receding gums are not just a dental issue, they can also be an early sign of bone loss in the jaw, which is linked to osteoporosis. If you notice your teeth appearing longer or your gums pulling away, it could indicate that the bone supporting your teeth is weakening. Regular dental checkups can help catch this sign early and prompt further investigation into your bone health. Losing teeth as an adult is not normal and may be a sign of osteoporosis affecting the jawbone. When the bone that holds your teeth in place becomes weak, teeth can loosen and eventually fall out. If you experience unexplained tooth loss, especially in combination with other symptoms, it's important to get your bone density checked. A gradual decrease in your ability to move or perform daily activities can be an early sign of osteoporosis. As bones weaken, you may find it harder to walk, climb stairs, or maintain balance. This loss of mobility can increase your risk of falls and fractures, making it important to address these changes early. Muscle weakness, especially in the legs and back, can sometimes accompany osteoporosis. As bones lose density, muscles may have to work harder to support the body, leading to fatigue and weakness. If you notice unexplained muscle weakness or fatigue, It could be related to underlying bone health issues. Persistent pain in the hip area can be an early sign of osteoporosis, particularly if it's not related to injury or overuse. The hip is a common site for osteoporotic fractures, and early pain may signal weakening bones. If you experience ongoing hip discomfort, especially if you're at risk for osteoporosis, it's important to have it checked out. Wrist pain or fractures from minor falls can be an early indicator of osteoporosis. The wrist is another common site for osteoporotic fractures, especially in postmenopausal women. If you notice pain, swelling, or reduced function in your wrist after a minor bump or fall, consider osteoporosis as a possible cause. Unexplained rib pain or fractures can also be an early warning sign of osteoporosis. The ribs can become fragile and break easily, sometimes even from coughing or sneezing. If you experience rib pain without a clear cause, it's worth discussing with your doctor, especially if you have other risk factors for osteoporosis. Feeling unusually tired or fatigued can sometimes be linked to osteoporosis. As your bones weaken, your body may have to work harder to perform everyday tasks, leading to a general sense of tiredness. While fatigue can have many causes, persistent fatigue along with other symptoms may warrant a closer look at your bone health. If you find it increasingly difficult to stand up from a seated position, this could be an early sign of osteoporosis. Weak bones and muscles can make it harder to rise from chairs or beds, especially without using your arms for support. This change in mobility is worth noting and discussing with your healthcare provider. Problems with balance and coordination can sometimes be linked to osteoporosis. As bones and muscles weaken, maintaining stability becomes more challenging, increasing the risk of falls and fractures. If you notice you're stumbling more often or feel unsteady, it's important to address these changes early. A loss of appetite can sometimes accompany osteoporosis, especially as the disease progresses. Poor appetite may lead to inadequate nutrition, which can further weaken bones. If you notice a persistent decrease in appetite, along with other symptoms, it's important to address your overall health and nutrition. Frequent muscle cramps, especially at night, can sometimes be associated with osteoporosis. These cramps may be due to low calcium or vitamin D levels, both of which are important for bone health. If you experience regular cramps along with other warning signs, it's worth checking your bone health and nutrient levels. Restless legs or discomfort in the legs, especially at night, can sometimes be linked to bone health issues. While restless leg syndrome has many causes, it can sometimes signal mineral imbalances or early bone loss. If you notice this symptom along with others, consider discussing it with your doctor. Some studies suggest that hearing loss may be linked to osteoporosis, as the bones in the ear can also become fragile. If you notice a gradual decline in your hearing, especially with other symptoms of bone loss, it may be worth having your bone health evaluated. Shortness of breath can sometimes occur if osteoporosis leads to spinal deformities that restrict lung capacity. As the spine curves forward, it can compress the chest and make breathing more difficult. If you experience unexplained shortness of breath, especially with other symptoms, it's important to seek medical advice. Chest pain, especially if it's not related to heart issues, can sometimes be caused by rib or spinal fractures due to osteoporosis. If you experience chest pain after a minor injury or without a clear cause, it's important to consider bone health as a possible factor. Digestive problems, such as constipation or difficulty swallowing, can sometimes be linked to osteoporosis. Spinal changes may compress the digestive tract, making it harder for food to pass through. If you notice persistent digestive issues along with other symptoms, it's worth discussing with your doctor. Frequent falls, even without injury, can be an early sign of osteoporosis. Weak bones and muscles can affect your balance and coordination, making you more prone to falling. If you notice you're falling more often, it's important to address your bone health and take steps to prevent fractures. Swelling or tenderness in the joints or bones can sometimes be an early sign of osteoporosis. While these symptoms can have many causes, persistent swelling or tenderness, especially after minor trauma, should not be ignored. It may indicate underlying bone weakness. Numbness or tingling in the arms or legs can sometimes be linked to osteoporosis, especially if spinal changes compress nerves. If you notice these sensations along with other symptoms, it's important to have your spine and bone health evaluated. If you notice that cuts, bruises, or fractures are taking longer to heal, this could be an early sign of osteoporosis. Weakened bones and poor circulation can slow the healing process. If your body seems to be recovering more slowly than usual, it's worth discussing with your healthcare provider. Unexplained weight loss can sometimes be associated with osteoporosis, especially if it's accompanied by other symptoms like fatigue or loss of appetite. Losing weight without trying may indicate underlying health issues, including bone loss. If you notice this change, it's important to seek medical advice. Night sweats can sometimes be linked to hormonal changes that affect bone health, especially in women going through menopause. While night sweats have many causes, if they occur alongside other symptoms of osteoporosis, it's worth considering a bone health evaluation. Mood changes, such as increased anxiety or depression, can sometimes be linked to osteoporosis. Chronic pain, fatigue, and hormonal changes can all affect your mood. If you notice persistent mood changes along with other symptoms, it's important to address both your mental and physical health. Difficulty sleeping or insomnia can sometimes be related to osteoporosis, especially if pain or discomfort is keeping you awake. Poor sleep can also worsen other symptoms, making it harder to manage your health. If you're experiencing insomnia along with other warning signs, talk to your doctor. Frequent headaches can sometimes be linked to osteoporosis, especially if spinal changes affect nerves or blood flow in the neck and head. While headaches have many causes, persistent or unexplained headaches should be evaluated, particularly if you have other risk factors for osteoporosis. Increased sensitivity to touch or pressure over bones can sometimes be an early sign of osteoporosis. If you notice that areas like your spine, hips, or wrists are more sensitive than usual, it may indicate underlying bone changes. This symptom should be discussed with your healthcare provider. Difficulty swallowing, or dysphagia, can sometimes be linked to osteoporosis if spinal changes compress the esophagus. If you notice this symptom along with others, it's important to have your bone health and spine evaluated. Frequent urination can sometimes be associated with osteoporosis, especially if spinal changes affect nerves that control the bladder. If you notice this symptom along with others, it's worth discussing with your doctor to rule out underlying causes. A loss of interest in activities you once enjoyed can sometimes be linked to osteoporosis, especially if pain or fatigue is interfering with your daily life. If you notice this change along with other symptoms, it's important to address both your physical and emotional health. Cold hands or feet can sometimes be linked to osteoporosis, especially if poor circulation is involved. Weakened bones and reduced activity can affect blood flow. If you notice persistent coldness in your extremities, it's worth discussing with your healthcare provider. A change in the way you walk, such as a slower pace or a limp, can sometimes be an early sign of osteoporosis. Weak bones and muscles can alter your gait, making it harder to move smoothly. If you notice changes in your walking pattern, it's important to have your bone health checked. Unsteady or shaky hands can sometimes be linked to osteoporosis, especially if nerve compression is involved. If you notice tremors or difficulty controlling your hands, along with other symptoms, it's important to seek medical advice. If you find it increasingly difficult to lift objects that used to be easy, this could be an early sign of osteoporosis. Weak bones and muscles can make lifting and carrying more challenging. If you notice this change, especially with other symptoms, it's time to check your bone health. Recognizing the early warning signs of osteoporosis is crucial for protecting your bone health. If you notice any of these symptoms, especially if you have risk factors, don't ignore them. Early detection allows for timely intervention, which can slow bone loss and reduce the risk of fractures. Talk to your healthcare provider about bone density testing and lifestyle changes that can help strengthen your bones. Remember, taking action early can make a significant difference in your quality of life.